I said, hey, I'd like to do that. That could be quite enjoyable. So we've thrown around or talked about extensively collaboratives, and one of the collaborative efforts that has stemmed from Fayette Care Clinic, for which they serve as the lead, is what's known as coordinated collaborative care. Coordinated collaborative care came out of meetings that 6 executive directors of nonprofits found themselves in. And they found themselves sitting in these meetings looking at the same people and realized through conversation that not only were they looking at the same people, but they were probably serving the same sector of the population of Fayette County. So thinking through some things, if you're serving the same sector, providing the same services, you're probably not maximizing your resources, and you're probably duplicating some of those services. If we look at who makes up the 6 nonprofits that work together, they include Fayette Care Clinic as a lead organization, Fayette Factor, Real Life Center, Fayette County Health Department, McIntosh Trail Community Service Board, which locally we know as the Fayette Counseling Center, and Promise Place. If we look at the mission and the purpose is to provide comprehensive patient and client care, and the way in which that is done is basically through a referral network. The thought process being, if you have an uninsured resident of Fayette County, they deserve the same dignity, they deserve the same compassion as someone with insurance. If you have insurance currently, you have a referral network of doctors and providers that are open to you. So the thought was, let's provide the same to the uninsured residents of Fayette County. We found that this has limited the duplication of resources, reduced organizational costs by maximizing efficiencies, and in maximizing efficiencies, we've enabled the Real Life Center, Fayette Factor, Promise Place to do exactly what they do best and to focus on a particular sector of clients that they serve. So what's been the collaborative effectiveness? Cheryl mentioned the Community Foundation for Greater Atlanta, which provided funding in 2012 for an administrative coordinator's position. That administrative coordinator spends a lot of time tracking data and also serving as the center of referrals for the various organizations. In 2011, 97 patients on an informal basis were tracked. And as time went on, there was a couple of realizations. One was there's a prescription assistance program that was included, provided by an outside vendor, for which 39 patients were assisted. Because of the Community Foundation and the administrative coordinator, in 2012 to date, this system has served 343 shared patients, meaning that they've come into one organization, be it the Fayette Care Clinic, be it the Real Life Center, and they've been referred to at least one other organization. This has totaled about 558 referrals overall. And in-house within the Fayette Care Clinic is a prescription assistance program. The prescription assistance program was revamped and revitalized and actually streamlined a bit better in that there's now only a 10-day turn time, and they've provided 341 prescriptions to total value of services of $157,000 of prescription. Now, that doesn't necessarily include the individual providers, it just includes the collaborative efforts. As far as the achievements, first and foremost, outside of just looking at the screen, first and foremost is the quality of patient care and client care, because we go back to the dignity that's provided through this referral network and the opportunity for individuals to be treated holistically, both mentally, spiritually, and physically. However, the Community Foundation, again, provided an award through the Organizational Partnerships Program. In addition to the Fayette Factor, was selected to provide collaborative efforts into the Neighborhood Nexus program, which is a Community Foundation's partner program, and I believe they partner with the United Way on that. I think I'm correct in that, Jim. Okay. And the Joseph D. Green Award was provided to this collaborative from the Healthcare Georgia Foundation. That occurred in May, and the Innovation Award from the Georgia Charitable Care Clinic. All of this to say that, truthfully, this collaborative really is serving as a statewide program, noticeable program, and receiving state recognition. So just wanted to provide a few comments regarding the collaborative for which I've been a volunteer. Of course, you can have a wide variety of services. If you can't get people to those services, it really doesn't matter. So Debbie's going to focus a bit on transportation.